The Peconic Bay Medical Center mission has morphed into being the regional medical center for the East End. The Canis Regional Heart Center is a critical component of that. Having advanced cardiac care, along with being a trauma center for the region, a stroke center for the region, really has positioned Peconic Bay Medical Center and Northwell Health to be the regional medical center for all the residents of the East End.
It feels great. It's been a very, very long time in coming. This dream and this hope has existed for a very long time, and we could not be more excited to have it being brought to fruition.
I can't imagine a community being without regional health care and specialty care for as long as this region has.
Through my career, the Cath Lab has become an incredibly exciting place in cardiology. It's no longer just a diagnostic facility, but it's also a therapeutic facility. We can bring patients in and correct the problem without having to do things like surgery.
For heart attack patients, every minute counts in saving heart muscle.
Time is the most critical piece in the care. The sooner you can open up a blocked artery, the less damage to the heart muscle. In fact, you may not have any damage at all.
The EMS community, when they have a patient having a heart attack, they can bring that patient to a hospital that is much closer than in the past and know that that life-saving care is waiting as they come into the emergency department.
When you're dealing with a complex medical problem, it's really important to have your families close by and your loved ones around you. It helps with the healing process. It helps with understanding the process.
The people who live in the community now understand how important it is for them and their families to have this degree of cardiac service.
I'm extremely proud to be part of this team from the Cardiac Cath Lab. The training that they've undergone, the experiences that they've had, the way that Northwell as a system has been able to provide education through the Center for Learning and Innovation makes this team one of the best trained cardiac cath teams on Long Island.
Over 200,000 people live in the area that do not have that kind of care, which seems ludicrous considering which century we're in. It's given me a lot of satisfaction to be able to create an environment that can provide that care.
I live in Southold, a half hour east of here, so this is my hospital. There's such a sense of community here at Peconic Bay. The staff here, they work here, they live here, and there's this incredible sense of pride of ownership of the staff.
Speaking from my personal experiences and having to travel all the way to Manhasset for my procedure, it is a true blessing. As we've expanded our emergency services, as we expand our cardiac services and are able to provide for the people that are my neighbors and my friends.
The hospital was founded in 1952 because a farmer had a heart attack and died before he could get to the closest hospital. 65 years later, it is truly an honor to bring this life-saving program and this life-saving team of individuals to this community.